Next, we get to hear a very powerful force in our national policy for psychedelics. Former U.S. Senator for Arizona, Senator Kyrsten Sinema served Arizona for nearly 20 years in the United States Senate, United States House of Representatives, and the Arizona State Legislature. She is an attorney, a licensed clinical social worker, a professor, and advocate for psychedelic medicine as a breakthrough treatment for veterans. Senator Sinema, we're honored to welcome you, your perspective on psychedelics and public policy, shaping a national framework.
It's an incredible honor to be here with all of you today, and I feel so excited because I'm learning so much from so many other individuals who are speaking and working together today. I was asked to come and talk a little bit about how to shape a national framework. So I thought, well, that's an easy task, and I've got, my clock has no time on it, which is very dangerous for someone who's a recovering elected official, but free license. It's very unusual. Someone like me would end up serving in public office for 20 years. I was born in Tucson, Arizona, to a family that was very culturally conservative. Grew up in a very, very conservative religious household. And in my early years, we were just kind of a normal middle-class family. My mom was a homemaker, and my dad was an attorney. And like many families in my generation, when hard times hit, my family suffered and struggled. And my parents divorced, and my family went from kind of being a normal middle-class family to homeless. And so for a number of years in my childhood, we lived in an abandoned gas station. Didn't have running water, didn't have electricity, sometimes didn't have enough food to eat. And like many, many families facing financial stress or difficulty, also faced many other emotional difficulties. It was an interesting time in my childhood, having been born and raised in a family with such conservative values. So I was taught early on kind of the traditional conservative values, working hard, pulling yourself up by your bootstraps, hating the government for sure, and the idea that you must do it on your own, but also living in a situation where my family and I were dependent on others for food, for shelter, for help. So I'm so grateful because I got to grow up with kind of both of these juxtaposed political ideologies in our country, right? Traditional conservative values and yet traditional liberal values of helping each other and protecting those who are vulnerable and in need. And I think it was kind of that juxtaposition that allowed me to become an elected official who didn't ever fit neatly, as you may have seen, into either political box. Nobody puts baby in a corner. And I spent my political career kind of moving back and forth between the two political parties, never fitting well with either, thank goodness. But always learning and speaking the language and understanding both of those political ideologies. It allowed me to learn how to navigate complex political systems and find solutions and outcomes in highly unlikely places with highly unlikely people. And so when we think about shaping a national framework, I come to it from that perspective, a perspective of understanding the very different opinions that we have within our country and the different places that we all come here together, both from and for. We are all here for something different, but each of our own reasons to be here today are equally valid. No one is greater or better or stronger or weaker than the other. So to build a national framework that allows us to reach our ultimate goal, to ensure that these life-saving medications are available to all individuals in our country who desire effective, rapid-acting, short-term, non-addictive treatments that actually work, right? Actually work. I think through what it is that we must do to achieve that goal, that shared goal. So I consider the strategery that we come together with. And today we've heard about a diversity of not just beliefs, but a diversity of strategies and tactics. I want to briefly cover kind of 4 categories of those strategies and tactics and highlight why each of them is incredibly important to this shared ultimate goal to ensure that these medicines are available for all in our country who need them. So first, we have state-based actions, state initiatives, like the one that Amy has participated in and has helped forming in Colorado, that regulates state-based usage of plant medicines that was passed through a voter initiative. Initiatives like here in New Mexico, where state legislative leaders like Andrea and others who are here today created a regulated program for medical psilocybin. These state actions will have a world of difference for the residents of those states. It will transform their lives. And through those actions, they can create models for other states and tips, both mistakes and opportunities to copy at the federal level. So those laboratories that start at the state-based action, incredibly important. We also have those who are utilizing existing federal laws and frameworks, like Sue Sisley in Arizona, who is doing groundbreaking work to utilize the federal right to try law that will allow for the administration of psilocybin and eventually other medicines for life-threatening diseases, available to individuals in America after just one phase 1 clinical trial through the FDA, proving the safety of these medicines. Or the utilization of new laws, like a new federal law called the Halt Fentanyl Act, that expands the use of Schedule I medicines for research. It's a second category that allows us to push the medicines forward in safe and effective ways while showing not only the ability to save lives, but collecting data for us to utilize for that ultimate goal of ensuring these medicines are available to all Americans who need them. By supporting federal agency action, expanding the use of MDMA-assisted therapy at our VA facilities, which is occurring right now and is being expanded under our new VA Secretary, Doug Collins. The movement forward of psilocybin-assisted therapy at VA facilities all across the country, and the preparation for Ibogaine treatment at VA facilities across our country. And then fourth, state action towards federal FDA approval. You heard earlier today from the unbelievable Brian Hubbard, who shared the story of Texas's legislative effort to appropriate $50 million for a first ever in the history of our country public-private partnership for FDA research for the use of Ibogaine for opiate addictions. And in my home state of Arizona, through not just my efforts, but the efforts of Matt, who you heard from earlier, and other veterans who partnered with us to pass in Arizona legislation funding phase 1 clinical trials for Ibogaine for the use of treating traumatic brain injuries and other neurological disorders like Parkinson's disease. And we have passed legislation. In years past, Arizona passed legislation to appropriate dollars for psilocybin clinical trials that are allowing for the first time ever the use of natural mushrooms in clinical trials at the FDA level. So these 4 categories of action, which each seem separate and distinct, are actually all incredibly important. The diversity of those strategies and tactics creates the groundswell, the opportunity for cross-learning and collaboration, and to build broad data sets that will get us to an ultimate goal of providing legal and safe access for these medicines to individuals across this country who need it in a safe and affordable way. So now we think about what are the challenges that we face as we approach this federal framework. One challenge we face is the danger of favoring one medicine over another. We see this happening a little bit around the country. The reality is, and we know this here today, that each of these medicines is sacred and special. And each of these medicines has a different usage for different people and a different effect on different disorders, opportunities for healing, and conditions. We must not fall victim to saying that one medicine is better or greater or lesser than the other. These medicines must move together for widespread acceptance and legalization in this country. We also, yes, thank you. I saw you, Lance. Okay, we also must avoid the temptation of bickering or disagreeing with each other around the different strategies we're utilizing. Each of these 4 categories of strategies are absolutely important for this long-term goal. And so rather than say, oh, we shouldn't do that, we should do this, look for opportunities for cross-collaboration, for learning, for sharing data, for sharing the lessons that we take from each of these different categories and strategies. We must not allow political ideology to divide us. This is not a partisan issue. We cannot allow the movement to make these medicines accessible for everyone in this country to be divided by right or left, liberal or conservative. Our message is different with each community that we speak with, because our message must be tailored to the needs of that community. And by listening and understanding, we can make that connection to ensure that whatever reason someone comes to the table of yes for these medicines, that reason is excellent. That reason is excellent, whatever it is. It does not have to be yours, but it is excellent. And our 4th risk, our 4th challenge we face, is a deep responsibility we all hold, whether we're practitioners or policymakers or responsible for building the systems. And that is to ensure that we reduce the risk of isolated but potentially highly publicized adverse events, which could occur as a result of poor or inadequate regulation or a lack of trained, careful, and honoring utilization of these sacred medicines. So these 4 challenges are large, right? But these are the challenges we face as we move towards this national framework. And now I'll list out just the incredible opportunities that are presented for each of us. We know there is a growing desire all across this country for effective treatments, as opposed to what we have today. Less effective, long-term medications that in many cases create dependency themselves and do not treat the underlying wounds or injuries that exist. Right now, we have a movement in our country, some call it MAHA, others call it Dr. Andrew Weil. This movement towards clean consumption, eating cleaner food, fewer artificial substances, reducing the toxicity in our lives and around us, whether it's the land or the food or the substances we take in. Regardless of the name of this movement or where you sit on the political spectrum, this is an opportunity for us to marshal more individuals to learn about the power of clean medicine that actually solves and heals rather than covers up and creates more problems. We have the benefit of outstanding data, unparalleled effectiveness that are progressing across this country. We are at a special time in our country. Regardless of your feelings about the politics at the state, local, or federal level, we today do enjoy members of our federal leadership team that recognize the desperate need for effective medicines to treat traumatic brain injuries, PTSD, treatment-resistant depression, obsessive-compulsive disorder, opiate and other substance addictions. We have an opportunity to connect with leaders who are willing to speak about this publicly and who want to affect this change in our country. So we must focus on this shared goal to ensure that all individuals in America who need access to this medicine can safely and affordably access it. And to do so, we must form and maintain alliances, even with those with whom we may disagree on other issues, to achieve this shared goal. Thank you.